Alrighty. For those of you who aren't here, what we did so far, I handed out I had a change of heart, and I went ahead and handed out the abbreviation sheets. So next time you come in, or before class sometime, get with me. I will give you those sheets, and I will give you the ones to mark on the sheet that you need to learn for the quizzes. We'll talk a little bit about why we're doing those things. The other thing that I'm going to talk about today is something that I think we all need to remember, and it kind of goes along with most of you have been in 262, and a big thing we talked about in the intro course is how it's, person-centered planning, and how we look at the person first, not their diagnosis or their disability. And we need to, that being said, we need to look for strengths, not weaknesses. So this class is about assessment. So the first thing that comes to mind when you're thinking assessment is, what's wrong with them? How can we fix them? What are we looking for? What can we, because if we're going to improve somebody's life, obviously they have something going on that we need to rehabilitate, we need to fix, we need to enhance, we need to help, right? So I've got a little, it didn't translate very well. It was I made it into a PowerPoint today where we could use it. Let me share screen here and go here. And I'm just going to leave it right here because sometimes when I put it on these, it won't change. It'll just show the initial slide. So y'all will just have to kind of bear with me on this, and I will scroll down and click as we go through. But the main thing that I want you guys to remember and to take out of this, and this is going to take, we're just going to start it today, and I'll finish it in the next class talking about this. And the main thing is what I'm saying. We need to look at assessment as not just a situation where we're looking for what's wrong with someone, where their deficits are, what's, that sort of thing. We also, at the same time, need to be looking for their strengths, and we need to be looking for positives, because it's just like I said, who wants to talk about things that they stink at? Nobody wants that. You also want, if you feel like somebody cares about you, they're going to ask you about things that make you happy. They're going to ask you about things that you enjoy, and those are the kind of things that fit in with this strength-based assessment. And it's kind of a whole construct that you have to think about, because if we don't watch ourselves, what you will find is that we really follow that medical model that we talked about, where someone has something wrong, we need to fix it. And that's just human nature. As someone who is a therapist or working in a medical field where you are helping someone, you're just drawn to say, what's wrong with them? What do we need to fix? You also need to say, what's right with them that we can use to help them get better? What are their positives? What can we build them up and build off of? So that's what this is really all about. And some of this is, there's no other way to do it other than to just kind of read it to you. But I'm going to elaborate a good bit on kind of what we're talking about. Something we need to remember when we're talking about therapeutic recreation is that we're trying to build strengths in the people that we serve, right? In the fact that we're trying to improve their life, that we're trying to empower them, that we're trying to, lower depression, that we're trying to enhance self-esteem. All of those things is we're building strengths in them, right? And for them to be able to improve, they obviously have the strength within them to be able to do that. So, as it says here, TR is historically grounded in the medical model of practice, which is exactly what I said. What's wrong with the patient? What do we need to do to fix it? This is wrong. This is what we need to do. It's all about that. And there's an ecological model where you look at the person and all of their scenarios, what sort of living arrangements they have, what things that they have available to them, their strengths, their whole ecological system, and how it plays into helping them get better. It's a much more positive way of assessing. I have no idea what in the heck happened right here. A sea change. I don't even know what that. When I transferred this from over to a PowerPoint, some of the words jumbled together, and y'all will just have to excuse me. You can this will work on your reading comprehension of being able to look at this and break up the words and all. But there's a big change that's happened in Health and Human Services. Focuses on orienting services towards people's individual strengths, towards their assets, towards their talents, and their aspirations. And that's important because, we talked about when we do our assessments and our initial interviews and things, that's one of the things that we're trying to find out, right? What are your aspirations? You're here with me because you want to do what? You want to get where, And so you get their goals, you get their wants, you get their where they want to be, and that's what their aspirations are. You also, through talking to them, you find out what their strengths are. You find out what their assets are, what they have available to them, as far as family structure, as far as support, things like that. What talents they have, what are they good at? What is something that they can do that they're really proud of? So, if we're going to build up strengths, we need to assess them, right? So this session is going to talk about some different tools and approaches we can use, and we're going to look at both internal strengths, because we all have things within ourselves that are positive and that are strengths, whether it's intelligence, whether it's, we all have internal things and external things that are going to be strengths that we have. So my goal with this is to, even if as we're going through these case studies, you will notice as we're doing that we're going to gravitate toward that, okay, well, it said that she's an amputee. She can't, this is what's wrong. She can't walk. We also need to think as we're going through it, what can she do well? What does she like to do? What does she want to do? Does she have a van at her disposal to be able to transport here and there and get around easily? Because that opens a lot of doors. That's a positive. That is a strength. So we're going to look at things like that as we go along. So kind of defined this already. We'll talk about the difference, and I'll give you some good examples. In these next slides, we'll have some different ways of looking at this. Between a strengths approach of assessment and a deficits approach of assessment. And there's a big difference. And it's kind of in table format, so it's really easy to follow as we go through. So we'll look at some internal and external strengths that we can assess. And we'll look at several tools. I'm not sure that it will be exactly 6 that we'll cover in here. But it's going to use more of that ecological approach where we look at the person, their situation, their surroundings, their home life, what they have available to them as a whole. And that's what we'll kind of learn to look a little deeper into those things. So, some principles of a strengths-based approach like we talked about. Everybody, every group, every family, every community has strengths. Families tend to stick together for the most part. You have some, but everybody has things that they're good at. Some people may have more challenging lives than others and things like that, but every individual, group, family, and community has strengths. What are some good things about our community here in Oxford, or just the Ole Miss community? What would you say?
I would say it's very friendly and very welcoming. Everyone I meet is very nice. It's something that
Yeah.
I like about it.
And it makes you feel comfortable to get out and be social, and for that reason, yeah, that's absolutely a strength. Now, something that we don't look at a lot of times, and you have to think about, is this second part. It says that difficulties are also sources of opportunity and challenge. You know, everything in life doesn't come easy. When do you feel the most proud of yourself? When you've overcome an obstacle that you really didn't think you could? Does that make you feel like extra good about yourself? It does me, you know. So we need to look at difficulties as things that can be overcome, and say, look, this isn't all bad. This is, when we get to the other side of this, you're going to look at this and be glad that you went through this. You see how that's a positive spin on a difficulty? It's just kind of a way of thinking. Something else that it says here, and this is something that we are all kind of guilty of at times, I think. We don't know the upper limits of a participant's, a patient's, a client's capacity to grow and change. So don't assume that we do. Think about where, some of the places where you can work as a recreation therapist. Correctional facilities. Are you going to have preconceived notions about these people for the most part? Is it just natural for that to be the case? Absolutely. Don't assume that they won't change, that they can't change. Might they let you down and not change? Absolutely. Think about drug and alcohol rehabilitation facilities. They have a lot of frequent flyers that come and go. They're there for 30 days. They do great. They get off of everything. They are detoxed. They look like they're thriving. A month later, they come right back in. But you also, like I think I said it in here before last time, I actually am a TikTok guy some, and I watch a lot of the things, and a ton of the things that come across my timeline are people who are, bragging about sobriety. This is day 897 of sobriety. You think at one time that person didn't think they could do it, and all the people around them didn't think that they could do it? Don't assume that someone can't, because eventually what has to happen for change a lot of times is that one thing has to absolutely click inside of the person, and once it clicks, they decide to do it. I'm that way with eating, with like a diet. I got way too big at one point and went in for my yearly checkup. They told me I was basically diabetic because my A1C was too high. And, I was just cruising along, just throwing everything I could in my mouth. And that day, snapped something in my head, and I was like, nope, I got little kids. We're not doing this, and it clicked in me that day, and I lost about 90 pounds, because and if you asked somebody right before that if I could do that, they probably would have said, no, he's a fatty. He likes to eat too much. But no, when something actually clicks and you decide as an individual it's time to change, that's when people become successful. That's when these frequent flyers that come back to the drug and alcohol rehabilitation facilities finally don't come back, because they hit a point where it's rock bottom and it's time to make that change. And when they really buy into it themselves, that's when they find it. Next, an important thing, a big word, collaboration with our participants. And it has in parentheses here, not expert domination. We don't want to come to them with this all-knowing approach and say, I'm the professional, this is what we're going to do. Collaborate with them. Talk about what they enjoy. Talk about what they don't want to do. Collaboration leads to them really buying into their program and seeing more success out of what they're doing. Because they have had some say in what's going on, okay? We have to realize that every environment is full of resources, whether it comes across that way or not. I mean, you think of inner city where it's not a beautiful sight when you come in there, okay? If somebody comes in there, cleans up an area, paints a mural on a wall, is it going to increase that area's ambiance dramatically? Absolutely. And if that happens there, then what may happen to the adjoining area? They're going to be like, hey, this looks good. This is so much better, and it can bleed over. So even environments that don't seem that full of resources do have it. Context matters, how we talk to people, how we treat people. Hopefulness is something else that matters. We need to exude that to our patients, and that I believe in you, you can do this. That sort of thing. When we are behind them and we are hopeful and we are positive, then that's going to rub off on them. We need to realize that strengths can be nurtured / improved. And if that's going to be the case, just like everything else we do, it needs to be kind of trackable. So we need to assess to get kind of a baseline of where they are on their strengths. We need to do planning to figure out how we can enhance that. We can focus on strengths, which is something that we tend to not do a lot of times. And evaluation, obviously, that's where we see whether or not these strengths are being nurtured and improved upon. So here's where we kind of get into this strengths versus deficits approach that we talked about. And it's a big difference on these, as you'll see. Like in the deficits approach, which is the one that really doesn't fit the best mode, in my opinion. It's the one that we are all drawn to do because it's the easy way. What's wrong with them? We got to fix it. We see the person as a case, as a diagnosis. This is what we're dealing with. What we need to realize is everybody's unique and they have their own talents. They have their own resources because of being unique. In the deficits approach, you're going to see emphasis on what's wrong, what's missing, what's abnormal. The emphasis is going to be on the problems. We don't want the emphasis to be, if somebody's harping on your problems all the time, how's that going to make you feel? Not good. Are you going to look forward to coming to see somebody who's going to do that all the time? No, not at all. Now, do we need to address problems? Absolutely. We can't ignore those things, but we don't want to just focus 100% on those things. In the strengths approach, your emphasis is on strengths, resources, capabilities, aspirations, what you want to do, and adaptive processes, which is in turn going to give them hope because you're saying, this is what we can do to help you reach your aspirations of what you're wanting to do. You're looking in a positive manner and saying, these are adaptations we can do to help you. Next, the participant is viewed as a problem that needs to be fixed. Intervention is problem focused. Yes, we are trying to solve problems. We are trying to solve issues. A kind of a better way to look at it, the participant is viewed as potential waiting to be developed. Intervention is possibility focused. This is where I think we can get to with you. Where do you want to get? I think we can do that. It's a much more positive, much more, you're giving them a lot more support, a lot more supportive way of looking at things. Next, the professional is the expert concerning the individual's life. Ooh, how would you like that? You like somebody thinking they know more about you than you do? No. We need to realize that the individuals and their families and the communities that they're from and their social circle, they're the experts when it comes to each potential client. Deficits approach. The expert professional interprets a person's story to arrive at a diagnosis. To a certain degree, yes, we have to do that. That's what assessment is about. We're trying to figure out what's exactly where we stand. It's not necessarily it doesn't have to be a diagnosis per se. Well, a better way to look at it is that the professional gets to know the person by learning the person's story, by learning their background, and through interpretation of the events by talking with and working with the client, with the family, with people that know the individual, that are going to be there, and that helps you to get to know the person. You're not just saying, hey, I know all this stuff, this is what you need to do. You're getting their input, you're getting their story. By doing that, it shows you that you care about them as a person. Are they going to trust you more because of that? Are they going to like coming to see you more because of that? Absolutely. All right, there's some more. In the deficits approach, professional develops a treatment plan for the individual. Using the strengths approach, aspirations of the individual, their family, and community are the focus of the work that are going to be done, and that plan is developed in collaboration because, all of these people are going to have a support system, and they're going to have people that they're going to talk to, or at least I sure hope they do. There's some that don't really have much of a support system. But if they have this especially, you need to, even if you don't have the family and community that you can focus on, you focus on the aspirations of the individual and where they want to get and where they need to be. And yes, we may have the knowledge that when they tell us their aspirations, that we may need to tame their aspirations a little, just help them to be realistic in as positive a way as we can. Hey, let's get to this place first and then we'll try to work on getting to there. Okay, let's do this a step at a time. And what you're doing by doing that is giving them the opportunity to succeed. And every time they succeed, they're going to feel better about themselves. They're going to feel more self-reliant. They're going to be more positive inside and believe that they can get to that next step because they're seeing these successes. They're getting there time and again. Next one. A framework and vocabulary is developed to describe problems. In the strengths approach, you pull up the same thing and you use that to describe strengths. In the deficits approach, play, recreation, and leisure are viewed as superfluous experiences only tangentially related to improving a person's health. Basically saying that they are what? Not important, not necessary, right? If you're in here and you believe that, I hope that you change your mind because play, recreation, and leisure are, as it says here, they're integral to well-being. And some people play more than others. Some people's recreation and leisure, everyone's is different, right? But we all have to recharge. We all have to do things that we enjoy to, maintain our sanity. It's the way that I look at that. They are essential, as it says here, to recovery and rehabilitation. In the deficits approach, absence of illness or dysfunction is the goal, whereas in the strengths approach, we're looking for well-being, we're looking for thriving, we're looking for high quality of life. And you can reach those things while still having a certain degree of illness or dysfunction. People can be happy. People can be, think of someone these people that you see that are amputees and still are living a very fulfilling life and doing all the things that they wanted to do. You know, there's a lot is tied into attitude. And the people who have the attitude of what, this isn't going to stop me, are the ones who thrive even if there is illness or dysfunction present. And then bottom line, in the deficits approach, it goes strictly by this medical model that we talked about, where it says, this is what's wrong, we must fix it. The strengths approach, ecological model is used, where we try to look and improve the entire situation for the individual, thus helping them to thrive, have a high quality of life, and you know, improve their situation in that way. So, this one really put my letters together. Look at this one. It's like one big word. Definition of a strength from Webster's Dictionary. The quality or state of being strong, vigor, power of resistance, vigor of action, a strong or valuable attribute, a source of power or encouragement and sustenance. And then, as we talked about a little bit already, we have internal strengths and then we have external strengths and resources. All right, what do you guys think may be some internal strengths that an individual may have? And we'll see if they're on this next list on the next slide.
Self-motivation.
Absolutely.
Self-control.
Self-control, absolutely.
Willpower.
For sure. Those are kind of tied together a little bit, but yes. Intelligence, you know, that's within. Anybody else think of anything that just sticks out? As far as internal, let's see what they have here, or what I have here. Sorry. Aspirations and goals. If somebody has a lot of those, that means that they have a good frame of mind and a good positive outlook, right? Someone who doesn't have that's not going to have a lot of aspirations. They're not going to have a lot of goals. They're just won't care, right? So that's an internal strength to me. Interests and preferences, the same thing. What are the things that you're passionate about? You know, your passions are internal strengths in turn. Talents, skills and competencies, knowledge, and then one we didn't talk about that it's very much true, character strengths and virtues. You know, the ability to know and do the right thing even when nobody's looking, like they say. You know, that's a strong character, goes a long way. And that's an internal strength that can definitely count. Some examples of some external strengths that we have here. Family support. You know, some cases, like I said, you have more than others. I worked at NMRC, like all of you know, for a long time. And most of the families have a good bit of good family support. You have some that come and pick up their loved one once a week and take them out to lunch and take them home for the weekends and take them home for holidays and keep them there for 2 weeks, and you know, a lot to bring them clothes and money to spend at the, you know, vending machines and all these things. You have some who have a lot of that kind of support, and then you have some that we're basically like that child that you see in the news that's dropped off on the doorstep in a plastic bag. You know what I mean? Like, here you go, don't want them, don't know this kid. And the director of NMRC becomes their, I can't come up with the word, their legal guardian at that point. So, they don't have that external strength at that point, but what they get is a lot of support from the staff, who becomes their family, from the director, who spends extra time building a relationship with these clients because they don't have that family support. Social support and friends. Another reason why recreation is not something that we can just toss to the wayside. That's when a lot of people make their friends. You know, we had nightly recreation activities when I was working there, where we had an activity from 6 o'clock until 8:30 every night, and it may be a dance. It may be, we may show a movie in the auditorium and have basketball or kickball going on in the gym area. So we may have multiple families, we may have a group playing bingo over in another corner. I mean, we'd have several things going on at once. And what you find is you have people with similar interests that are going to come together. You have people with similar skill sets that are going to come together. And what you do is that there, because you're at a facility, long-term facility, and you're with people that you're going to be around a lot, they become your social support. They become your friends. They become something you look forward to every day, coming to night rec and seeing your friends. And that's an external strength. That is a resource. That is something that keeps you ticking and wanting to keep rolling, you know. Community resources. Some areas are better than others. You know, as far as recreation, how good do you think Oxford is? Decent? Terrible? Great? I think decent is a good word for it. I think there's room for more. For the size of the town, I think it's relatively good, you know. The thing about it that plays into that a little bit is the fact that it is a college town. And back when I was in school, when school let out for the summer, it was a mass exodus and students were gone and this town was empty. Not so much anymore. A lot more students are staying in town and it doesn't clear out quite as much. Now, does it become less busy? Yes. But you find in the summertime, there's not enough students sometimes to help run restaurants, you know, because that's where all their servers are. You have places like movie theaters that are not nearly as busy as they would be. The bowling alley, they're just not as much business. So there's a fine line between too many recreational options in an area like this that you still have to try to keep open, and you're going to lose money during a certain time of the year. So I think we're pretty good. We have a lot of people don't really take advantage of it. We have a good park commission here in town that has a lot of offerings for adults, even, you know, to do different activities. I signed my kid up for baseball last night. Ooh, he's still playing basketball right now. I live at the park commission, it seems like, more than when I worked there almost. But you have community resources. What kind of things are there that are strong? When you think about people who may have disabilities, do they have community resources such as a bus that can pick them up if you are in a wheelchair? If that's the case, that would be an external strength that would mean a lot. Right? That solves the problem of getting to places. It matters. That's an external strength. Home resources. You know, what do you have as far as support from home? Do you have monetary, you know, do you have enough money to do things that you want to do and you're not in a bind in that way? That matters. Opportunities for participation and contribution, that's a good chance to be meet like-minded people who have the same sort of ideals as you. Inclusive communities it has here. Inclusion was kind of the word I was looking at. High expectations and positive attitudes. If an area or the people around you, okay, this has a lot to do, like think about peer pressure. And if you've got a bunch of friends, buddies, that are high achievers, and you like all set a goal that you want to go to Harvard, you think everybody, if they really bought into it, you think they're going to really work harder on their school because they all want to go together, and it buys, and you're all kind of bought into it? If you have high expectations and positive attitudes from the people around you, it's going to rub off and it's going to be a positive, right? Just like if you're sitting around with a bunch of deadbeats all the time, what are you going to become? One of them, right? This is your ecosystem and how it plays with your life. All right, I'm not going to get too deeply into this picture, but basically what it shows is around this outer area of the graphic here, you're looking at external strengths and resources in your environment. Okay, these are the things that are around you. Things like your home resources, all of the things that we just named, family support, your friendships, high expectations, all of those things. Recreation can be used to build your strengths, to build off of those things. Eventually, your recreation becomes a strength, and it's become part of your internal strengths because it's part of you. You know how long does it take to make something a habit? Something, I don't remember exactly, but if you do something religiously for a certain amount of time, before long, you don't feel right if you're not doing it. You know, people say that about working out. It's just you build that and it becomes part of you, and recreation in that way, if you treat it as a positive thing, it's going to become part of you and become part of a strength. We need to realize that. Okay, so when we're doing strengths-based assessment, like we talked about, we're focusing on internal and external strengths that we've talked about. We need to remember that the participant is not just a client. They're not just someone with a problem that we have to solve. They are potential waiting to be developed. Is that a much more positive way to look at that person? You know, this is where we can get to. It's not, this is what's broken, we must fix. A framework is used to assess and describe their strengths. We need to bring those to the forefront a lot of times, where even the patient, the client themselves realize the things that they have that are positive, that are, strengths that they can use to help them. Now, once we understand their strengths and once our clients understand their strengths, that's going to help them understand that will help us understand how to plan interventions for them. Okay? We can give them times to shine along the way, if for nothing more than building morale. We know that they're great at something. Every so often, set them up to do something that they're good at, that they're going to blow the lid off, and they're going to walk around with their chest poked out because look what I just did. Everybody needs that every once in a while, right? And we have to remember that it's ecological, which, just like anything else, that's just everything that surrounds us, your whole story. Your family, your community, your friends, your background, what you have available to you. Let me see how many of these we have. Yeah, let's hit one or two more. All right. Here we go again with the strengths versus deficits approach, right? And I will give you the deficits first, followed by the different that will cover the strengths approach to assessment. In the deficits approach, you're going to define the diagnosis as the problem, and then we ask questions that are related to problems, needs, deficits, and symptoms. Okay, that's very medical in nature, right? Very medical based. We're not talking about well-being other than this is what's wrong. How often does it happen? What do we need to, how bad is it when it occurs? When you're talking about a strengths approach, you're going to define a holistic portrait. You're going to find out what the patient wants. You're going to find out what they desire, what they aspire to, what they dream of, what talents they have, what skills they have, what knowledge they already have. So you're getting the full picture, and you're getting the positives along with the whole story. Because when you're finding out all those things, you're going to find out what you need to about your patient. In the deficits approach, you search for the nature of the participant's problems from the perspective of the professional. Yourself, how you feel about it. I'm the smart one. I went to school for this. That's kind of the attitude that would be the wrong one to take. It's analytical in nature. Strengths approach, you gather information from the standpoint of the participant's view of the situation. You find out how it feels to be them, how it affects their life, how they would like to change it, how life would be better if this was different. You get their input. That's the main thing. In the deficits approach, a lot of time we're not getting enough of the patient's input. So remember that. That's where we show that we care. We get their information from them because we ask them about what they truly care about, what they want to improve. In the deficits approach, it is interrogative in nature, where you're basically just hitting them with questions. We're talking about an assessment where we're just, okay, what about this? What about this? They feel like they're probably in the jail cell getting hit by the detectives. You don't want it to be that way. It's not interrogative. It needs to be conversational in nature. Think you're going to get a better picture of the person that you're talking to if it's more conversational? Are they going to be more at ease? Are they going to be more open? Absolutely. So we need to remember that. With the deficits approach, the focus is on the diagnosis to determine the level of function. With the strengths approach, you're going to focus on the here and now. Where are they right now? It's going to lead to a discussion about the future. Where do we want to get to? Where do we want to be? How have you managed so far? What have you done to cope in the past? What would you like to try? Questions like that are very much more positive in nature. In the deficits approach, a lot of times the participant or the client is viewed as having lacking insight regarding the problem, illness, or diagnosis. Believe me, they know what's going on with them. If they have a diagnosis, they know what's happening. We don't need to educate them on what substance abuse is, if that's what they're here for. I'm sorry, they're going to understand it. So we don't want to make them feel dumb by sitting there preaching to them about something that they are already very well versed at. In the strengths approach, we view the participant as a unique human being who will determine his or her own wants within their environment. And where we can help and where we can guide is helping them to make the right choices through conversation, through positive feedback, to help them choose the things that will help their environment be as positive as possible. All right, last one. In the deficits approach, the participant is a passive container for interventions as professionals direct decision making. They just sit there. This is what we're going to do. We don't involve them. We don't let them give much input. You know, it's literally like we're just pouring what we want them to do right into them. That's not the way to go. Using the strengths approach, the relationship with the participant is primary to the process. We want to build a relationship. We want to build a rapport. Now, they need to understand. Now, when I say that, we can't be best friends with our clients, right? You have to have a delineation there. If you start blurring that line, that's when you start running into issues with ethics and things like that, right? And we know how that can be. However, they need to understand that we do want to have a relationship with them where we hear about their wants and needs, that we want them to be part of the decision making, and it's going to be a joint decision making process. Okay, it's not just a thing where we say, all right, you're here for this. This is what we do. Here's what you're going to do for the next 2 weeks. It's not like that. We need to build that relationship with these people. Deficits approach. The participant is placed in a diagnostic or problem category using generic, homogeneous language, basically lumping everyone who has similar situations. Well, all of y'all who drink, this is what you do. This is how you feel. I know, because all y'all are the same. Is basically what you're saying by lumping a group together that way. Don't want to do that. Strengths assessment, you're going to be specific. You're going to be unique, and it's going to be detailed. It's going to be individualized. That is, I'm telling you guys, therapeutic recreation, that is one of my favorite words and one of the biggest words that we will use. You know, we got to know that every single patient, client is different, and even just conversationally, it needs to be individualized. Now, may you have some certain questions that you need to ask each person, that you need to get this information from everybody? Yes, but the way you address certain people as you get to know them, some people need to be handled a little more gently. Some people need you to just get straight to the point, and you know, different people have different personalities, and that's why it pays to get to know our patients. Deficits approach emphasizes compliance and management of problems and needs with formal services seen as a solution. Compliance. You gonna do what I say. Is that what you think of, like with compliance? That's what I think of when I read that word. It's saying, this is what I think you should do. Let me see you do it. Comply with what I tell you. Never mind, I'm going to bite my tongue on something. Okay. In the strengths approach, we explore the rejuvenation and creation of natural helping networks and social supports. We teach them how to use the things that are already there that maybe they're not using. They have social support. They have people around them. They have positive things that they can use that are in their environment or that are within themselves. We help them to find those things. We don't tell them, this is what you're going to do because I said so. In the deficits approach, it's totally controlled by the professional. In the strengths approach, we give the participant a great deal of ownership. We add our expertise. We tell them why we think we should do this. And sometimes we may have to finesse them a little bit to talk them into something that we know is best for them. But if you make them feel like it's their idea, they're going to believe you. They're going to go along with it. And I'm not talking about tricking people. I'm talking about doing what is best for your patient and how you handle specific ones. Sometimes you have to make people believe it was their idea for them to buy into it. And there's ways to talk to people to get them to that point. Deficits approach, professional dictates What I think you need to learn and work on is, that's straight up. This is what I think you need to do this. Strengths approach. The professional asks, what can I learn from you and about your life? Once you get that information, then you've shown that you care about the individual. You're going to glean a lot of good knowledge that you can pull from and say, what do you think about this? How about we work? How about we learn about this and work on this? Instead of, what I think you need to do is this. You see the difference between those two things? It's huge. If I was sitting in that seat, it would make a big difference on my compliance level. Let me look at what the title of this next one is. Okay. Give me 1 second here. I'm going to take a picture of exactly where I am, where I will know where to start next time. Oh, that's me. Selfie king up here. Okay. Thank you guys for your attention today. We are going to next class jump right back in and finish this. I hope this was kind of eye-opening and at least somewhat interesting to you, because it truly is different from the way a lot of people look at treatment. You know, it goes away from that medical model and it looks at a more positive role. So as we're doing these assessments, I wanted to lay this framework where we can keep that in mind, like once we get into these case studies, to not just jump straight to, okay, what's wrong with them? Let's also find out what's right with them as we're going along. Y'all have a great day. Don't freeze. I will see you guys on Tuesday. Have a good, safe weekend, guys. Thank y'all.